Fahi Musthagbal series ga aluganmenna hivvaru libe fada message take devvam wadan nevi ADK ge senior consultant Dr. Mohamed Shafiu. Dr. Mohamed Shafiu aki cardiovascular adi thoracic surgeon ne ಬಾವಿ ಸಹಾರು ಮಿದಾಯಿರಾಗ ಹಿದುಮೆ ಕುರವ್ವಾಫಾವ ಬೇಫುಳೆ ಅದಿ ದೇಹಾಸ್ ವಿಹಿವಣ ಆಹಾರು ಮಿ ದಾಯಿರಾಯಿನ್ ಇವ್ವರ್ದಿನುಮ್ಗೆ ಗೌಮಿ ಇನಾಂವೆಸ್ ಲಿವಡ ನವಾಫಾವ ಬೇಫುಳೆ ದೆನ್ ಮಿ ಲೆಕ್ಚರ್ಯ ಫಹು ಅನೆ ಸುವಾಲು ಹುರಿಯಾ ತಿಯ ಬೇಫುಳು ಮಿ ಡಾಕ್ಟರ್ ಶಾಫಿ ವಾಹ್ ದಕ್ಕವ ನೆ ಮುನಿಮ ಸುವಾಲು ಕುರವು
Bismillah. Assalamu alaikum. Actually, I am known for my writing skills than speaking skills. So I may get stuck in between words. So please bear with me. I have really stage fright. Okay. So my topic is leaving my comfort zone. So what does it mean? So I was okay. I was happy. And why did I leave it? Is it that I want to achieve a bigger goal? Or is it I want to prove something to somebody or some people? Or is it that I want to, as a form of vengeance? It could be above all, okay? So this is my topic I have chosen. As you know, I operate on 3 systems. One is heart, one is whatever inside that happens in thorax. Sometimes we team up with neurosurgery to remove tumors from the spine. And when it comes to vascular, I team up with orthopedics because they know limbs better than me. So this is my area of interest. So if I were to start from the very beginning, I think within 30 minutes I will not be able to complete. So I will get right to the meat and potatoes of my presentation. So let's say, assume that I have already completed my MBBS. I have crossed my general surgery training. And now I am about to enter into cardiothoracic surgery training. So from there I will take, if we have enough time, if time permits, we can always go back and review the slides. Okay, so I will be justifying like that. So this is my prayer. I thank Allah subhanahu wa ta'ala for making me a cardiac surgeon, giving me the opportunity to witness the miraculous design of human body, which surpasses all understanding. I thank Allah subhanahu wa ta'ala for the opportunity to attempt to ease suffering. May I remain open-minded, humble, caring, and comforting as I share my skills and experience with my patients and with my colleagues. And may I remain thoroughly grateful to my entire life. Ameen. Alhamdulillah. So before I start, I would like to make a disclaimer and a declaration. See, I am here as a cardiac surgeon. So I want to I want everybody, even if not physically, at least mentally, I want to make everybody a cardiac surgeon or a surgeon at least. Okay? So I will be a salesman. So tomorrow, if you call a physician or an anesthetist, he or she will be promoting that. So the only way I can do is by comparing. So I will be pulling lot of legs of non-surgical people. Okay, that is part of my thing. And another thing is, this is my story, my creation. So no part of my statement should be used as an outcry or an out of context and used as political truth. Please understand that. Now I'll skip this part and head back when I was, okay, we'll travel in time machine. We'll go all the way to me getting into cardiac surgery training. So how did I get into cardiac surgery training? So it was, if I have one minister in mind, whom I respect, whom I have self-esteem high, I hold him high, is Honorable Minister Ahmed Abdullah. He is a man with a vision. Okay, when he was health minister, he really wanted to develop the local nurses, doctors. He wanted to train, improve the human resources. He wanted to. So I have seen literally going and begging different institute deans, please give opportunity to Maldivian students. So all the specialists you see in and around who of my generation are because of his work. And one special thing he did was, that is his legacy, is creating a cardiac center. So he signed a MOU. So under the MOU, there used to be a cardiologist from Sri Chitra deputed to Maldives. Every 3 months they get rotated. So once his term was over, that MOU was signed. So under that, Dr. Ali Shafiq went. As you know, he's also quite a renowned, he's actually speaking, what is the difference between me and him? He's a cardiologist, he's an interventional cardiologist. I believe he's one of the best in the region, if not the best, because we studied in the same place. And he's my classmate from grade 8. Okay, so we are very close. So what's the difference between and me? So imagine a coin. A coin can be a coin if the only two sides are different. If two sides faces of the coin are same, it's not a coin. So what my work and what he does is complementary to each other. Okay, so it's very unfortunate that why we are not able to work under the same roof. Okay, and you will come to know why. Okay, so how did I get into this? The thing is, like I said, the MOU was there. He already started his training in 2007. So in 2007 and 2008, he calls me up and says, hey, there's an opportunity to you to come here. All you have to do is get a minister's approval letter. Okay, so the winds now, Ahmed has passed the torch. Somebody else was there. And my boss was Dr. Firdaus, whom we all respect and whom we believe is the modern day father of surgery in Maldives. I went with my problem to him. He said, okay, I will arrange an appointment with minister. You go and meet him. So I go with high hopes. I just wanted a letter of approval. Then he tells me, do a feasibility study and come. Me, feasible study. I'm not an accountant. I'm not a consultant. I'm, of course, a consultant in surgery. I'm not a consultant in that sense. Okay, so it was disappointment. Then the political scenario changes, 2009. So that time, Dr. Razi was the acting CEO of the institute I was working. So I approached him. He says, so this is the thing, I don't want this opportunity to go away. So please help me. So he goes down and meets the professor, the one wearing a maroon shirt in the middle, seated. He's JK sir. He's a very renowned surgeon. So he says already local candidates has been selected, but you can bring the candidate in the November. We'll interview him separately. And then if he's cardiothoracic material, we'll take him because the session starts in January. So I go in November. So I didn't know how to prepare also because nobody guided me how to prepare. So whatever I thought might come, academically I prepared and went. When I went there, so I was mentally prepared to worst question, you could possibly ask. Then the first question, the third from the left, that is Dr. Shankar. He asked me, are you ready to divorce your wife? Which stunned me. I thought, did I hear right? Then I thought, where is he taking me? If I say no, where is he going to take me? But I say, right, he's going to take me. I really didn't know where he was going to take me. Okay? Then I kept quiet. Then he pointed to the extreme left. He's also part of, he's the assistant professor. So he said, during his training, he nearly divorced his wife. That means how tough the program is going to be, okay? So that is the thing. So my colleagues, Dr. Ubaid and Dr. Shifan, time to time they check on me. How are you doing? How are you training? So the only way I could describe is like Kung Fu Panda training. I think everybody must have seen the past part of Kung Fu Panda. Okay, he becomes a chosen one by accident. So Master Shifu doesn't like him, isn't it? So in order to get rid of him, they make the life tough for him so that he will leave and quit. So I was undergoing same type of situation. I was not ready to quit, okay? So I will not go into details and scare you people. So there may be somebody who wants to be following my shoes. So if I tell all negative things, it won't be good, isn't it? So now, if you are interested, since I didn't have a guide, at least you should see. I know through some of the medical students, you are expected to see this movie. Many students said, and then you should read 3 books. Among them, this middle book is the most important. If you read to cover, usually to pass the interview. Okay, it's a handbook, don't worry. It's not a big book. So now, I come back training after 2013, I returned. Already Dr. Ali Shafiq is doing his part, so we thought we will start our own department, okay? And, but then policies have changed, okay? Political scenario changed. Now it's a interim government. And I meet the health minister, he congratulated me, he's told me, my hands are tied, you better come when the re-election starts, then the new person comes, most probably I won't be there, and you again put your demands. So the thing is, because the policies of the thing was to privatize or outsource the thing, the MOU that was signed with the registrar gets voided because it's a government-to-government understanding. So now the only people who survived the training was me and Dr. Ali Shafiq. So no nurses, no perfusionists, no nothing. Okay, that's the sad part. Now, it is psychological. You come with a higher degree, everybody thinks, oh, the people who are holding the postings, their level is threatened, isn't it? But me and Shafiq was never interested in this sort of bureaucracy problems. Because I was given on a silver platter to become the medical director of the hospital when I was in general surgery, my much earliest part of my career, because I didn't want to become, because I was interested in surgical field. I thought if I move to that, my time in the OT will go. So I didn't want to do that. Now, the thing is, if one person comes, it's very easy to adjust the hierarchy and salary scale and things. Now, I am there. One nephrologist is coming. 2 pulmonologists are coming. So this group is increasing. So you can't, at an ad hoc basis, so we have to prepare a proper framework for hierarchy. So now, that is the story of the hunting dog and the watchdog. This I will come to that in my next slide. So when I returned, there was a lot of hindrance from my peers. Probably they, out of respect, out of fear, out of jealousy, or something was happening. They will refer the case to me, supposing I need to do a fistula for dialysis, or I have to do thoracic surgery, which I could do that by then. But then, when I go explain to the relative, when I see the patient, and I open the file, already 2 days before Asanda to refer abroad is written. It was like a slap on my face. Then in fact, this has been going on till the last 2 years also back, I had the same incident. So then I become a bit of a fiction between the relative and as if though I'm the person who is stopping them from going. Okay, so this was going on. While this was going on in people upstairs, my level, I was thinking, because my hands are idle, I'm not doing what I was supposed to do, I'm becoming blunt. Okay, so how do I prevent this? If you learn to ride a bicycle, you will not forget. But after many years, even if you ride, you will feel the confidence goes away. So I didn't want that to happen to me. So what I did was, I called up my colleagues. In fact, my colleagues who are immediate junior, my batch, and my seniors are the most close during my training. So they used to keep a check, oh, what is this fellow going to do? Okay, when is he starting? So they keep a track of me. So I call up and say, see, can I come over to your hospital and work with you? So what I do is I divide my annual leave, maybe 15 days here and there. So I go there. I don't need a visa to go. I'm already registered as a doctor, and I'm not employed. I'm just working under somebody, so I don't have any paperwork issues. So I go brush up my skills. That's how I maintain, okay? And then it's not that I don't want to start. I wanted to select candidates to target, because it's a teamwork. Cardiac surgery is teamwork. So I needed to create candidates who are potential for doing this. So I interviewed many nurses from ICU, and I pulled some staff from the theater also. I interviewed them with Dr. Ubaid because he was the head. We both sit and shortlisted a group of people. Among, I will mention one person's name, Yusuf. I think he is the first male nurse or second, I'm not sure. So whenever I think of a perfusionist, I will tell you who is a perfusionist. I had him to be trained as a perfusionist. So I approached him saying that, why don't you agree for this? He said, I'm settled down. Actually, he was very uncertain. Even I was not sure what I'm doing, isn't it? So who will go with me on an uncharted ocean travel, isn't it, without no guarantee? So he didn't want to leave, so which was very unfortunate to think. So these candidates were selected, shortlisted, and Dr. Rizana, at that time anesthetist chief, through his contacts in Singapore, these people, because since they have not seen a cardiac surgery done, so to familiarize at least sort of observership, they went to Singapore. Okay, the funding we got it through Islamic Ministry, some NGO sponsored. So same year, since I'm not doing much, I got an offer to go to Mumbai and work for 1 year as a fellow in pediatric cardiac surgery. So the problem was, for the bureaucrat, I was a small man trying to cast a bigger shadow, which was not true. Okay, so now coming to the story of the hunting dog and the watchdog. Okay, now people from administration has gone to Rice office to make a hierarchy structure. Now, in this story, there's a hunter. He loves both the dogs. And you can see the one on the left is the sleek build for hunting. Other one is a strong jaw. That must be a watchdog. So he loves both the dogs equally. Now, every day early morning, from the dawn of the break, sun comes up, he takes the hunting dog for hunting. And then they return. When they go, they see the watchdog sleeping. And when they return also, the watchdog is still sleeping. Okay, they come in the almost sunset. Now, the hunter goes into the house. Whatever the catch is, whether it's a rabbit or a duck or whatever it is, he makes equal portions and presents to both the dogs. Now, one day, this hunting dog is very irritated. Why is it that you are getting equal share and that I have spent my time hunting and spending? Then this watchdog says, see, hey, you have the comfort of sleeping inside the house next to the master's bed. I spend all my life in a canal, whether rain or shine. Okay? Then he presents a fox that has entered the premises in the night before, so he killed it. So he says, you cannot judge. My time of work starts from dusk to dawn. Yours is from dawn to dusk. Okay, so one very close colleague of mine who was there, apparently he said, Dr. Shafiu ke evves kame kura me hennone. Kive enea subspecialty musara dembi. You see, doni huri bandefa. Mudarnu badenya kine duveni. Isn't it? So I was doing with whatever the thing I was having. I was doing OPD. I was teaching my juniors. Every day I used to teach my juniors. I was on call 24 hours. I was doing thoracic surgery. I was doing vascular surgery. But the only thing I could not do is what I was meant to do, that is cardiothoracic surgery, which requires a big investment. You are not providing me that. Then how do I carry on? Okay, now this is now 2013 over, 2014 over. 2015 I already went for training. Now 2016, I went on a government bond which is bound me for 5 years. Okay, 4 years is going to be now. Now I become a rebel. Reason is, while I was in Bombay, Ali Shafi calls me up, hey, very sad man, I don't think we're going to run the department, it's been outsourced. Okay, fine. So I become Defiant. Now from Bruce Banner, I turned to Hulk. Literally, I turned to Hulk. So my point is to make an exit, because I realize no part of the agreement says that we are going to start cardiac surgery. There is no contract obligation for the party to start cardiac surgery. Then no longer, how long I wait here, I exhaust this thing, it is not going to start. So obviously my best choice is to leave. So I knew my dream is not going to be fulfilled. So I started applying. In fact, I wanted to go to Middle East. So I got 2 places. One I rejected. Then there was a opportunity to start a new department in pediatrics, and I was to lead or maybe as a subordinate to start. So although I cleared the interview, I just wanted to finish my paperwork. But my son was suffering from WPW syndrome. That means you have a heart rate that goes up and down. So because this was detected when I was in 2nd year of training, but because he was too small to do ablation, he required at least 20 kg. So by then he was 18.5 or 19 kgs. So I took him back to Sri Chitra. Then I met one pediatric professor. He said, what are you doing? I said, see, I did last year one this pediatric fellowship, and I have to come to know that there are no way we can do cardiac surgery, so I'm planning to move out. Then he said, no longer how long it takes, don't go to Middle East. Then he suggested, why don't you rent a heart-lung machine? So in India, it's possible. From one hospital, you can shift to other hospital, do the thing and pay the fee. But here in Male, what machinery can I can only get a concrete mixing machine. That I can get. You know, there is so many real estate, but I cannot get a heart-lung machine. Okay, so anyway, I listened to him, and I realized, oh, my son is sick, so better I not go. So now, my 5th year. Now, according to me, 2013, 14, 15, 16, 17, I'm done. So I moved to greener pastures. So from southwest of the island, I moved to northeast. These people are more receptive. They understand me, and they allotted me a budget, okay? I will not mention all these negative things, names and things, okay? I'm not promoting anything. So, my due respect, I applied. So I did clever thing. I had long accumulated leave. So October I took leave. According to me, December I'll get exhausted leave, then I'll apply my resignation. That was my plan. So during my leave, I had faced another issue. Now, when a surgeon, you must have seen in movies, when he does like that, instrument comes from the hand, okay? So I don't have to question what the instrument I need, how long. Nurses exactly knows what to give. Okay, this is true. It's not exaggeration in the movie. It really happens. So now I have to work like a procurement person. I have to know exactly the size of the instrument, which I'm not. If I moved from here to another hospital, they'll be already established. I just have to do my work. So now, and the thing is, all these catalogs and things are in PDF format. So if you open on a laptop, it will be this size. If you open a tabletop, it will be this size. Now they will say 1:1 scale of the instrument, okay? So I have to a crude method of having a scale and measuring right on the screen like a dumb person, okay? Trying to know the size, exact size. If I order the wrong instrument, I am given a fixed budget, obviously it will be a problem, okay? And then this instrument I have to use, okay? That's the issue. Then another issue came. Drugs. I am first time importing some new drugs, introducing to the system. Something like milrinone, levosimendan, phenox, cardioplegia drugs. These are new, never used. So I had to fight with FDA. Now anybody coming in my way, now you see I have turned to Hulk. Okay, so whoever is hindering way, I'll find it, somebody is obstructing my goal. So the negotiator in between, you know Abzoniaf, how he is, his mannerism. You know how calm and cool, diplomatic he is. So he was the go-between me and the FDA, okay, for getting approval. Now then, you understand doing a heart well, wells are expensive, and grafts are expensive. In cardiac surgery, everything is expensive. And now, imagine I have to do cardiac surgery, replace a valve, that means I have to compete with Amrita, I have to compete with KIMS. And I didn't have any clue that this bill will be asked and covered. I have to forward it to the, I'm in a private institute. Okay, so what did I do? I went all the way to all the regional offices, like Medtronic is situated in Mumbai. St. Jude, these valve manufacturers, one is in Delhi. So I took all the way, okay? I went and met them. See, I told I'm not a businessman, I'm a surgeon. I'm very interested to start cardiac surgery in Maldives. Please give you at the baseline this valve, then only I can afford. Actually, they were very obliged because this is a big thing for them. Because since both competition between among them, if I put a valve, they can write on their marketing this thing, first time use Medtronic valve in Maldives. So it's a big thing. So it's a win-win situation for both of us, isn't it? So they were very nice to me. Then there's the question of perfusionist. You know who is a perfusionist? Perfusionist is the one who runs the heart-lung machine. When we are doing open heart, heart has to stop. If the heart has to be stopped, obviously patient will die. So how we maintain is by artificial means. So, okay, that machine is run by somebody called a perfusionist. So it's a very responsible job, very professional job. Okay, if anybody interested, you can actually, the minimum requirement is a nursing degree or basics degree in science. Okay, then you can get into that field. So I wanted to register in the medical council. When I first applied, I said, yeah, no, it's not necessary, he can work. Then I said, no, he's a very responsible person. I don't know if, I know for sure it is not in the, as a doctor he should be registered, either it should be in the nursing or as a, what you call allied health. So finally, then they said, doctor, can you give me the job description of this person? So I had to provide that also. Okay, so now I take pride of ownership. When I was going through the instruments, you can see my situation. I was thinking of this meme, but when I do, I know nothing. Okay, this was my situation. Now I have to build up a team, okay, because it's not a single-man job or one-man army. So you know how wolf hunts and survives. Everybody in the pack is assigned a task. So right flank, left flank, chase, then ambush, okay? So one alpha wolf will be leading. So I need to have a good coordinated team in my field. So everybody is responsible for the survival of the patient. So typical cardiothoracic team consists of this: 2 surgeons, 1 anesthetist, 1 perfusionist, 2 scrub nurses, 1 floor nurse, and 4 cardiac MOs. Depending on the size of the CCU, we have a 5-bedded CCU, so we need roughly around 15 to 20 nurses. And then attendants, okay? So you can't be John Wick. You are dependent, so you have to be a team player. So, but thing is, I knew my perfusionist because the perfusionist was there with me in Bombay. I knew my anesthetist well, but I didn't know the caliber of my surgeon and my scrub nurses. You see a CV, they are qualified. But as long as you don't work, you don't develop that, you know. So it was very difficult. So what method can I do implement to do? So I did very scientific. So we did a simulation, okay? Our plan was to start cardiac surgery on 11th of August. We had a rheumatic fever patient requiring valve replacement. Because patient was in arrhythmia, required blood thinners, so we had to admit beforehand, we had to switch off to injections. So I admitted 1 week before. So the week prior, beginning, I think this was in Monday or Sunday, we did this mock-up. You can see nobody's wearing gloves, so it's not a real patient. So dummy patient was kept. Somebody, you can see, with a clipboard. So he's noting the stages, how much time it takes, okay? So when I did this, I realized, okay, I had a very good team. Everybody knew their place. They understood what I'm trying to do. So I was confident now, we can go ahead. Then, depending on what the shortcomings of this, we plan to do it on another repeat on Thursday. And then Saturday, we'll do the surgery. So this is the best I can do to understand everybody's capability and capacity. So having said that, we had to do a emergency bypass patient. 2 grafts required. So from 11th, what I targeted is shifted to 8/8/2018. Now, is it my fate? This is a very beautiful date, okay? So we did first, so this is my wolf pack. Now, though everything went well, this was my break or make moment. Why? The patient went because his heart was weak, it repeatedly goes to arrhythmia. Then I had to shock him thrice. By 3rd shock, I thought my career is done. Game over. I will no longer be a surgeon. I will no longer be, my career is done. Reason is, this is a very small place. My first case, okay? In fact, the administrative staff hospital were very nice. They were in and around looking over my shoulder what I was doing. Even the MD, when this happened, he nearly fainted, okay? So, because what happened is the same year, during Ramzan, I had to intervene, help a case with vascular injury. Unfortunately, the patient didn't make it. A lot of Maldivian renowned people, famous people came into negative attention of the media, and that was my lowest point of my career. I mean, was very depressed. And 2 strikes in 1 year means, obviously my career is over. But somehow, this is actually cardiac community is a very small niche group. Nobody wants to become a cardiac surgeon. Okay, so in that, somehow they came to know it was done. So you can see, first bypass was done in Maldives. It was published in 17 August 2018. Now, being a cardiac surgeon, is it worth it? You may ask. Why do I take this much risk? So you understand, next to cardiac surgery, most prestigious thing is neurosurgery. Okay, if you take a neurosurgery clean case, they have less mortality than us. Every case I take is around 50% mortality. Then, and this is a very expensive, resource-hungry field. So if I want to do a valve surgery today, and echo says 19 size is the diameter of the aorta, I have to 10. When I open, it will be 21 size, because there will be some calcification or artifact. It won't be. Looking at naked eye is different. So in order to do that, I have to have full range of valves. That means 17 size to 27 size I have to have. I may never use the 27 size valve, but without having, one valve I'll bring. You can't do that. That will expire. I will hardly use. But that is how things are done. So it's a very expensive, resource-hungry field. Another thing is physically, mentally very demanding. Many times patient doesn't make, and it really, really, really hurts me, because I put so much effort. And a lot of coordination, teamwork is needed. Then why do I go into such big trouble, man, to do this? Why? I could take an easy route. See, I could be sitting my foot on the desk, enjoying. Nobody will question my degree. Nobody will question whether I will not get, everybody will respect me in the society. The hospital does not know what I'm doing. If a case comes for surgery, I can just fill the asanda form and send him away. Very simple. But why do I go to this extent to do this? Because I believe medical care or Sikhi Nizam of the country can be improved by doing things here. Your local confidence can be built by doing things here. That's why I go. That's why I have great respect for Ahmed Abdullah. What are we doing nowadays? Wear a suit, wear a tie, go to all the neighboring the hospitals in Sri Lanka, India, and you fill the contract, Asan they approved. Bangkok, Asan they approved. Dubai, Asan they approved. North Pole, Asan they approved. International Space Station, Asan they approved. Moon, Asan they approved. Maybe in 20 years, when Elon Musk conquers the Mars, Asan they approve in Mars. Is this how you develop, improve the healthcare system of the country? I don't believe so. If a politician's term is 5 years, why can't that person sit around one first year doing homework, providing funding to send the person? It takes 3 years to train a specialist or subspecialist. That means before his term is over, he'll see his fruit of labor. Why can't we do this? Okay, I should not go further. So now, how stressful is my job? See, I stand for 8 to 12 hours most of the time. Sometimes if the case gets complicated, sometimes it goes up to 9 hours. I mean 19 hours, okay? And I never take a pee break. If I'm in this range, I don't take a pee break. I don't take coffee breaks. And sometimes it so happens, we are not able to finish the case before iftar. So somebody will pass a date under the mask. Like that also we have done. And sometimes we start early morning during Ramzan. That means right after Fajr prayer, before the sun rises, we start the case. In hope we can go to break iftar with the family. That also has happened. And we as a cardiac surgeon, because we stand still in one spot, we are prone for developing varicose vein, narfu pabali, you know. So I used to wear stockings before case. Then another thing is we are cervical spondylosis, because we use special loop magnifying. So we have to look like this, so it's a lot of strain on the neck. So what is the relief? I go to gym, I watch movies, I have a lot of big Blu-ray collection, and I play video games. Okay, you can see tiles on the walls, but don't think it is in my bathroom, okay? I stay rent, so the owner is very clever, so you need not do painting all the time, no? So you can see PlayStation 3, PlayStation 4 Pro, PlayStation 5, PlayStation 5 Pro, okay? So actually, if you are interested in surgery, you are supposed to play actually video game. There's proven that you improve hand-eye coordination, okay? Especially nowadays, you have to do robotics and endoscopy surgeries. And I have very understanding spouse because she is also from medical background. She is very supportive of me. Otherwise, I don't think I could do it. So now you may think why celebrating cardiac surgery is very important. Because reason is why this fellow is such a cringe topic. He's going on talking, cardiac, as though there's no end of the thing. Reason is till World War II, everybody believe heart is an organ that cannot be touched. If I get an opportunity to speak you on history of cardiac surgery, you will realize most of the things came through accidents. And in fact, if it wasn't for World War II or World War I, probably we'd still not be operating on the heart, okay? So sometimes war is good, I think. Okay, so that is the reason. So in the world, it is celebrated on May 6, 1953. That's when the heart-lung became into play and cardiac surgery became safe. So it means Maldives entered as a cardiac surgery certified country after 65 years, okay? We took our way, long time. So on cardiac surgery, what I do is I try to teach 12th class standard interns, medical students on this day, and we publish our milestones that have achieved. So this year, inshallah, alhamdulillah, we'll be celebrating 7 years of cardiac surgery in Maldives. So now my take-home message is, never be afraid to pursue what you passionate about, okay? I gave up everything. I don't care why this thing. And then take a bold step and leave your comfort zone. That's what I meant by being comfort zone. I was comfortable now putting my desk, table on the desk, and learn to take calculated risk. You must remember that bigger the risk, the bigger the reward. Better to have a fallback plan. I never had a fallback plan, but since you plan something and if you can't achieve, obviously you will be disappointed. So always have a plan B. That's very important. Now, consistency and discipline will carry you to the end goal. Don't think that I was the top of the class. I was never top of the class, okay? I had my learning difficulty. I had memorizing issues when I was a student in school. Okay, if there are two period, double period, you know, double period to run. So when teacher gives you something to memorize, by the end, I will not be able to do. I'll be detained. We have to go to detention class till I finish. So make your own legacy. See, in medicine, there's no superior field. Just because I'm a cardiac surgeon, I should not feel dermatologist inferior or something. Because who is the best doctor? Best doctor is judged by the patient. If you can treat him or if you can relieve his symptoms, that the doctor becomes the best for this. So among us, we should not feel that. So try to create your own legacy and try to excel in what you do best. That's what I'm asking. And have a spiritual connection in your worst times and in your best times. And one more thing is, beware for ego. It's a double-edged sword. The outer edge will cut your popularity while inner edge will cut your purity. So thank you.